Hi guys, so a couple weeks ago, I think it was a couple weeks ago, Alex and I did a post on the blog about packing list for top surgery, and one of the things in the list was a first aid kit. Now, we didn't want to go into detail about everything in the first aid kit because that would have made the post really long, so we're just going to do a video about it. So I'll get right into it. The first thing you're going to need is some sort of container to keep it in. We've got this, it's a 12-quart little miniature tote from Walmart, and it worked really well. So let's get into it. First thing is gauze. You're going to need a ton of gauze. Right after surgery, we had these really big 5x9 surgical pads on it. Those worked great. And then as he healed, we got smaller and smaller. Currently, we just have to dress his nipples, so we have these little 2x2 pads. They're like a buck at the Dollar General, so those work great. Next, you're going to need tape. This is paper tape. It was what was recommended to us by Dr. Steinwald. This is for sensitive skin because if you watch Alex's videos, you know that we learned that adhesive breaks them out really bad. So we've got the sensitive skin stuff. Also, Dr. Steinwald gave us this. It's medical grade surgical tape that we put on his incisions until we go back for his 6-week checkup. They'll probably give you these at the hospital, but they're just in our box. They're just cups that we used for measuring his JP drain output. Like I said, they'll probably give you those at the hospital. We also keep some bags in here so that if we're changing it and we're somewhere where there's not a trash can, we've got this to put all the stuff in. We've got Q-tips for applying the Neosporin to his nipples, so because it's more sanitary than doing it with my hands. That leads me to, we also have more paper tape. Never have enough of that stuff. Neosporin, you'll probably need 2 tubes. We're almost through this one. We've also got the scissors for cutting the paper tape and gauze if necessary. Gloves, you'll need a ton of gloves. This is like the 3rd package we bought since surgery. And you can, again, just a thing you can never have too many of. Additionally, just kind of like a weird little safety note. I keep all of his prescription information, especially right after surgery, in the box. That way, if something were to happen, if he had a reaction or something, we had to go to the hospital, I would have all the information in one place and just grab the box and go. Another thing that Dr. Steinwald really told us to watch for after surgery, obviously, is infection. A sign of infection can be fever, but your surgeon will talk to you more about that, so we keep a thermometer in the first aid kit. Stool softener. Medications can bind you up. It's a fact of life. You might need it. Hydrogen peroxide we kept in case the drains leaked or spilled on anything. It's gross, but again, a fact of life. This is oil emulsion dressing. This is going to be dependent on whether your surgeon uses it or not. I don't know if it's common practice or I'm not a doctor. But Dr. Steinwald has this on Alex's nipple sites between the nipple and the gauze. This just, to my understanding, prevents it from sticking. And we've used a ton of this. This brand is Adaptic. It's what's available at our local medical supply store. So we've got that. Alcohol prep pads. We have used a ton of these, especially when we were having to empty his drains on the regular, because these make it really easy to just slide it down and empty the drains. So you'll probably have a ton of those. Hand sanitizer. I went through a ton of this because, you know, in order to prevent infection, it's really important that everything's nice and clean. So we used a ton of hand sanitizer. And the last thing that we have in the box is this pill sorter. Not in the box is the notebook that we kept with the pill sorter to keep track of everything that Alex was taking, just to make sure that nothing was conflicting and that he was taking his doses on time. So that notebook was super helpful. That way I knew when he could have more pain medicine, when he needed to take antibiotics, etc., so on and so forth. I can't think of anything else that was in the box that was super important to us. Can you? Alex is filming, so I'm just making sure. So neither of us can think of anything else that was super important, but if we notice that we forgot anything, we'll put it in the video description, which, if this is going on YouTube, should be down there. I guess it's also down there on Tumblr, so it will be below this video if we think of anything else. Other than that, that is what we kept in our first aid kit. And, oh, one more thing I forgot. ACE bandages, 6-inch ACE bandages. That's what Dr. Steinwald had us wrapping Alex with to prevent swelling after surgery. So we have like 6 of those because you cannot get them clean faster than you need them. So We have a ton, super helpful, get the kind with Velcro. That's all I can think of, so if you have any questions, comment below if you're on YouTube, or hit the ask button if you're on Tumblr, and we will get back to you as soon as we can. Thanks!